You know, when you picture a surgeon, your mind probably jumps straight to that intense moment, the first cut. But what if I told you the real magic, the true mastery of surgery begins long before a scalpel ever even comes into view? Today, we're going to pull back the curtain on the meticulous, hidden craft that forms the foundation of every single successful operation.
So let me ask you this. What makes the surgeon great? Is it nerves of steel? Unbelievably steady hands? That's what we see in the movies, right? But the reality, well, it's so much more intricate, and honestly, way more fascinating.
Because the real secret is that elite surgical skill is built on a bedrock of painstaking preparation. It's all about the quiet, deliberate, and totally unseen steps that really determine the outcome. The operation has already started long before anyone even says the word scalpel.
And it all starts right here, with something that looks simple but is actually a surprisingly complex dance, getting the patient perfectly positioned on the operating table. This is a critical science that impacts absolutely everything that follows.
See, positioning isn't just about making the patient comfortable. It has 4 clear, vital goals. The first 2 are all about safety, making sure the anesthesia works right and that the body isn't put under too much stress. The third one, that's for the surgeon, getting the best possible view and access. And the fourth, which is so important, is about respecting the patient's dignity throughout the entire process.
Let's look at a couple of quick examples. You've got the Trendelenburg position. By tilting the patient's head down, gravity gently pulls the abdominal organs out of the way, giving the surgeon a clear shot for pelvic procedures. The reverse Trendelenburg does the exact opposite, tilting the head up to get better access to the upper abdomen. Simple tilts, right? But they have a massive impact on the surgery.
And you have to get this right, because the stakes are incredibly high. Make no mistake, the risks are real. We're talking about permanent nerve damage, painful pressure sores, breathing problems, or even cutting off blood flow to a limb. It is a serious, high-stakes balancing act between giving the surgeon access and keeping the patient safe.
Okay, so once the patient is positioned securely, the team begins what is almost like a ritual of purity, preparing the sterile field. The goal is simple, but absolutely vital: prevent infection. Period.
So how do they do it? Well, it breaks down into 4 key steps. First, any metal comes off to prevent burns from electrical tools. Second, hair is clipped, but only if it's really in the way. Third, the skin gets a deep clean with an antiseptic, and they often use a brightly colored solution so the team can see exactly which areas are prepped. And finally, sterile drapes are laid down, creating a fortress of sterility around the surgical site.
Now, here's a super interesting detail. You'd think a super clean shave with a razor would be the most sterile option, right? Well, nope. It's actually a big no-no. Why? Because razors create these tiny and visible cuts in the skin that can become breeding grounds for bacteria. Some studies have shown this can almost double the risk of an infection. That's why clippers are the way to go. They trim the hair without ever breaking the skin.
And now we get to the moment we've all been waiting for. But even here, the first cut is never just a cut. It's a carefully planned move, a perfect blend of art and science.
There is so much going through a surgeon's mind right before that blade touches skin. It has to meet the skin at a perfect right angle so the edges heal cleanly. They use their other hand to create just the right amount of tension for a precise line. And they're even trying to follow the natural creases in the skin, the ones that help hide scars later. All this is happening while they're mentally mapping out where all the critical nerves and blood vessels are, just millimeters below.
The surgeon also has a choice of tools. You've got the traditional scalpel for that classic clean cut. But there's also something called dithermy. You can think of it like an electric scalpel. It uses a high-frequency current that cuts and seals blood vessels at the same time, which really helps control bleeding. While there's no major difference in infection rates, some research suggests dithermy might lead to less pain after the operation. In the end, it often just comes down to what the surgeon prefers.
Now, the incision isn't a one-size-fits-all deal. It also depends on the approach. You've got open surgery with one large incision that gives the surgeon direct access. But more and more, you see the laparoscopic or keyhole approach. This means several tiny little incisions, one for a camera and others for long, thin instruments. And the benefits? They're huge. We're talking less pain, smaller scars, and getting you out of the hospital way faster.
Okay, so the main part of the surgery is done. But it's not over yet. Now comes the final and equally critical step, closing the wound. This is just as important as making the first cut, because it determines how well and how beautifully the body's going to heal.
Sutures, or stitches, are way more complex than they look. A monofilament suture is a single, smooth strand.
It just glides through tissue, and there's a lower risk of infection because there's nowhere for bacteria to hide. But it can be a bit slippery and harder to tie. A multifilament suture is braided, kind of like a tiny rope. It's way easier to handle and makes really secure knots, but that braided texture? Yeah, it can unfortunately be a hiding spot for bacteria.
Another big difference in sutures is whether they dissolve or not. Absorbable ones are used inside the body, on tissues that will eventually heal and support themselves. Over time, the body just breaks them down. Non-absorbable sutures are for tissues that need permanent support, or for closing the skin, where they'll be taken out later.
The technique matters too. With interrupted stitches, each one is its own little world. It's like tying a whole series of individual knots. It's super secure. If one stitch happens to break, no big deal. The rest of the wound stays safely closed. It's methodical, and it's incredibly strong.
The other main way is a continuous stitch, and this is pretty much like sewing a hem on a piece of clothing. A single thread runs the entire length of the wound. This is way faster to do, but it does have one catch. If that single thread breaks anywhere along the line, the entire closure could potentially unravel.
And of course, surgery is always evolving. Today, we have some amazing alternatives to traditional stitches. You've got adhesive strips that are great for small, clean wounds, tissue glue, which is a lifesaver for closing cuts on kids' faces without any needles, and surgical staples, which can close up the skin super fast, saving precious time in the OR.
This quote just says it all, doesn't it? Success isn't just about what happens during the operation, it's about all the knowledge, all the skill, and all the judgment that go into getting ready for it. The importance of that preparedness just cannot be overstated.
So the next time you hear about a surgery, I really hope you'll see more than just a scalpel. I hope you'll see that hidden craft, that quiet, careful artistry of preparation that really defines a great surgeon. It makes you think, doesn't it? Will you look at it differently now, knowing everything that has to happen before that first cut is ever even made?